site and allow for people to download this as soon as it is posted on the website. So again, this is a virtual town hall for Oceana County and Newaygo County residents to discuss the increased cases in your communities. So Kevin, if you want to go ahead and start with the overview.
Okay, I will. Thanks, Janine, and thank you to everyone who's on today's meeting. Go ahead and start with the total cases that we've had, and these numbers are as of yesterday at 3 o'clock when we updated our numbers. As of yesterday, we saw a total of 17 new positive cases within our jurisdiction. We had one of those was in Crawford County, 15 were in Oceana County, and we had one new case in Wexford County. Through yesterday, it brought our total, and this is an ongoing total, within our entire jurisdiction to 620 cases that we've had within our 10-county jurisdiction. Specifically within Newaygo County, we have 158 have had 158 positive cases. In Oceana County, we've had 254 positive cases. Now, of that total 620 cases, 344 of those meet the definition of recovered. And definition of recovered is from the point that that person is confirmed a positive test. If that individual is living 30 days past that, that meets the definition of recovered. And so they would meet that standard. So of the total 620 cases that we have had, 344 of those meet the definition of recovered. And in Newaygo County, of the 158 cases that we've had, 103 meet that definition of recovered in Newaygo County. And in Oceana County, out of the 254, 82 meet that definition of recovered. So that gives you a little bit of a background on the cases that we have had. Related to the deaths that have occurred within our jurisdiction as a result of COVID, we have had 16 total deaths within our jurisdiction. We have had 3 deaths in Oceana County and no deaths in Newaygo County to date from this virus. So those are the case numbers that we are looking at. Also wanted to give you a little bit of background on our process for case investigation and contact tracing. Now, case investigation and contact tracing for public health entities is a very familiar task. This is something that we do with all communicable diseases. So it's not just something new or specific to COVID, but anytime we would receive confirmation of a communicable disease, this is the process that we would go through. So with COVID, once we are alerted to the fact that we have a positive case and we have confirmed that, then one of our public health nurses will begin the process of initiating a case investigation. As part of that case investigation, we will try to ascertain all of the potential contacts that this individual or individuals may have encountered. And we start that process at the point that we've determined that symptoms have begun. We will go back 48 hours. And then that is where we will begin to gather those contacts from at that point. Now, in terms of a close contact, what defines a close contact? Generally, it is less than having contact with an individual and you are closer than 6 feet to that individual for at least 15 minutes. That is the definition of what we consider to be a close contact. So I don't know if there's any questions on that or if Dr. Morris has anything specific that you would like to add to that.
Dr. Morris, you're on mute. If you can unmute.
Sorry about that. No, I think that's good. And that definition for close contact is the same for the rest of the country and most other countries in the world.
Okay. Once all of those, and then just to kind of finish up on that, once all of those contacts have been determined, then our staff will go through and risk categorize those. And then based on that assessment, they will reach out and begin the process of contacting those individuals or contact tracing and providing appropriate guidance to those individuals. And again, a lot of that is going to be determined by what that initial contact with an individual may have been like. So that is the process of case investigation and contact tracing that, again, we use not only for COVID, but for any type of communicable disease that we are dealing with. All right, and then I think Dr. Morris was going to go over some of the data.
Okay. Well, with looking at the cases that we've investigated so far, for Oceana County, about 60% of the cases, or about 2 out of 3 of every case that we've had, have been associated with a total of 5 different outbreaks occurring in different facilities. And those have been farms or factories. None of them have been public businesses or businesses where anyone from the public could visit. So they've been isolated just to the employees of those facilities. One outbreak did start in May, but most of these have been going on during June. So that's why we've been seeing a lot of big increases just recently.
Hey, Dr. Morris, can I interrupt? Can I interrupt real quick and just ask that everybody please mute your lines? Mute your phone, mute your computer. We're getting a lot of background noise. Thank you.
So again, 2 of those outbreaks have been very big, and 2 of those outbreaks alone have accounted for 80% or for 4 out of 5 of all of those outbreak cases. So of all those cases associated with those facilities, about 1 in 5 have been in the family members or household contacts of the employees. So we count those as part of those facility outbreaks because they're really linked to those facilities. But we see that happening where people get sick at work and then go home, and unfortunately their family members get sick as well. We don't know all the specifics of every single case right now. It's hard to get all that data available. But for those that we do know about, 1 in 4 of those never had symptoms. And it's hard to know, chicken and egg. A lot of times we'll see people that had symptoms and then their family members get tested and are found to be positive, but they never develop symptoms. Sometimes workers get tested because others were sick at work and they're found to be positive, but you never know if someone at work was positive, never had symptoms, never knew to get tested. Did they start the outbreak? It's just really hard to know how that all started. So of others in the community who were not part of those outbreaks, so the other 40%, about 1 in 4, or about 26% is what the math works out to be, don't know where they caught it from. So we consider those community acquired cases. And there's really no specific pattern to it. Some work in healthcare, some work in construction, but just as many are retired or unemployed. Some have testing done before they have surgery and have no symptoms. So it's just really all over the place. In Oceana County, about 1 in 6 people, or about 16% of people, had traveled into Michigan from out of state. So they actually didn't live here. They came in to Oceana County to visit family or to go to a funeral, or to come here for the summer, things like that. So 2 out of 3 of the cases that were not associated with outbreaks, so 60%, were associated to another case. They caught it from a household contact, from a family member, from one of the people that came in from out of state. So the vast majority are caught from someone else. So somebody catches it from who knows where, and then, several other cases will develop from that. So that is the typical, and that's what we see in research studies and in other communities, is that it's most commonly caught by those close to you. In Newaygo County, there have been several outbreaks there, but they've been much, much smaller. So about 1 in 5 cases in Newaygo County have been related to facility or farm outbreaks. Again, they're much smaller, and none of them have been public businesses. Only the employees have really been close contacts, or their family members are at risk, but we haven't really seen any family spread yet in that county. There have been about 88%, or about 4 out of 5 cases in Newaygo County that are not related to outbreaks. So again, looking at those 4 out of 5 cases, about 1 out of 4 cases, so pretty much identical to Oceana County. 1 out of 4 just don't know where they got it from. In Newaygo County, we see some people working out of county, working in Kent County, Muskegon County. We see truck drivers, construction workers, but again, also retired and unemployed who just don't know where they got it from. And then the other 3 out of 4 have known contact to a sick case. So they're the family members, the household contacts. So again, the majority of people, if they're not associated to an outbreak, which those are having close contact to sick workers, sick coworkers, they're connected to a sick household contact. So what I'll do now is, we did ask ahead of time if people had questions, they could email them in. We did get some. I'm going to go through those and answer them now, and then we'll open it up to questions if anyone has any remaining questions. So one question we got was, when it comes to contact tracing, if we find out that someone left out something critical, what do we do about that? So this happens quite a bit. We'll have people who, especially, if people are worried about losing work, or, just different fears and insecurities or worries. People say, nope, I haven't been anywhere. I haven't had contact with anybody. If we have concerns about that, sometimes we find out from other community members. They may call and say, you know what, I found out Mr. Smith has COVID. We cannot reveal the name of the individual, except for very, very limited situations. We can reveal it to healthcare providers if it's as part of their healthcare, and we have to be able to discuss it with their employer, but their employer then cannot reveal it to anybody. But they have to be able to notify contacts at work that they've had a contact, but again, they don't reveal the name of the person. So if someone calls us and says, Mr. Smith has COVID, I know he does, I was around him, we'll take that information and be able to investigate a little bit further. We may find out that there was a party that a lot of people were involved in, and we are kind of like detectives. We just really find ways to snoop around without divulging someone's identity. We are sometimes able to then present that to the individual and say, you know what, I know you said you haven't been anywhere, but we heard that. And oftentimes they will be more honest with us. Sometimes they're not, and we just have to do the best we can do. We can often talk to their healthcare provider, and they may have told their healthcare provider more information than they're telling us. We often will call their employer and find out, yes, they did go to work when they said they didn't. And so we just do the best we can do, but we're often able to find out more information. Social media has been an interesting tool. We can often go on their Facebook page and find pictures of them at places where they may have denied being at. So we do put in a lot of effort to find out people's contacts. If we do have beliefs that they were somewhere public and it's a risk to the public, we may put out a public notification. Like if they went to church, we may notify all the parishioners through a letter or an announcement at church, things like that. So another question was, what are some of the common recommendations you have regarding office settings? We do have a toolkit on our website for businesses, and the CDC has a lot of recommendations, but just real quickly, really important ones are encourage your workers to stay home if they're sick. Don't disincentivize people for calling in sick. Make sure that it's easy for them to stay home sick. Screen everyone coming into your facility, your workers, your patrons. Make it easy for people to use safety measures like masking, staying at a distance, all of those things. So for the sake of time, I'm not going to go through all of these, but again, there is a nice toolkit on our website. Another question was, are there transmissions being made by symptomless people? Like I said earlier, there definitely are. It's just hard to know how much. We know on average about half of people infected don't have symptoms. People are most contagious about 2 days before they have symptoms. So that pre-symptomatic period is one of the biggest risks. But we do know a lot of people in these outbreaks don't have symptoms, but it's hard to know who gave it to who, chicken or egg. It's hard to know. Where are these clusters happening? Is it at people's works, restaurants, stores, parties, families? So again, the two biggest issues are within people's homes and at workplaces. So really, we're not seeing a lot of a pattern to the community acquired. It's really hard to know, but again, that's the vast minority of people. The majority are workplace outbreaks, and then people that are sick going home and spreading it at home. So it's the biggest risks for transmission are who do you spend the most time with and who are you the closest with? So just those casual contacts are really not a major risk. Another question was, does Newaygo County have sufficient testing and contact tracing capacity or manpower to contain the outbreak? At this time, we do. We have called in some retired nurses to help us, and extra staffing is needed. And at this time, I don't feel, and Kevin can correct me if I'm wrong, that there's any concerns that we can't handle this. But we always have extra staffing available if needed. The state has staffing available to us if we need it. And the last word I received was that the healthcare systems have sufficient testing capability to those who need it. The next one is wherever I go, mostly the grocery store, I notice very few people wearing masks or improperly wearing masks. Do you think that is why we're having an increased number of cases? Even the store personnel aren't wearing masks. It's really hard to prove that. A study just came out recently that did show when certain states instituted mandatory masking in addition to stay-at-home orders, there was a decrease above and beyond the decrease in COVID cases they were already seeing. So it was felt that 20% of the decrease in COVID cases that we're seeing could be attributed to masking. So the fact that we're seeing fewer and fewer people wearing masks and we're seeing our COVID cases going up, you can't prove cause and effect there, but you know, it's a tempting thing to say, but we are seeing evidence that masking does help reduce COVID cases. Wearing a mask is to help protect other people. Wearing a mask is not losing your freedom of choice, but it's showing respect for your community members, your friends, your family. And when people choose not to wear a mask, you know, it's showing that lack of caring for others around you. We need to remember some people can't tolerate a mask, and that's okay. But hopefully, as we see these cases increase, we'll have more of an understanding of the importance for masking. Will you be posting exposure locations at like Grand Traverse County has been? With our numbers increasing, we need more information. The recent Grand Traverse exposure was a unique situation. That was a large party of people that had spent a lot of time in different bars and did have a lot of close contact, so within the 6 feet for more than 15 minutes. And so they did feel that posting that information was important. Typically, when we talk to people, they usually remember who they've been within 2 arms length of distance with for less than 15 minutes or more. If we have situations where people can't remember that, like a party or going to church, or going to the bar, we would make a bigger notification. And we have done that before. You know, if there's been birthday parties, weddings, church outgoings, usually those are done through someone else. So through a pastor or through the event organizer. It's not typical to have a public location where that's been an issue, but if there ever is, we would make a public notification like Grand Traverse did. We just haven't had that come up yet. But if we ever had a situation like that, we certainly would. But again, fortunately, we've had times where, again, it's been a party or church where we have someone who can contact all those people for us, or it's people that, you know, work together, or they just remember who all the people are that they've had contact with. So again, if someone were at a bar and they're like, yeah, I sat in a group of people, I don't know who they are, for quite a while talking, then we would make a public announcement about that. But casually walking through a grocery store, or even those that work within a grocery store, you know, if they're not having prolonged close contact with individuals, that is not considered to be a risk. And again, the data really does back that up as to how people are catching this virus. If a person tests positive who works in food service or grocery, what steps are taken to ensure the customer safety? Well, first and foremost, we make sure that person is not working any longer if they're contagious still, and make sure that they stay in isolation until they're no longer contagious, and assess and make sure if their coworkers are having any symptoms. And then we really find out, kind of like I mentioned earlier, what their contact with other people is like. The biggest risks are their coworkers. So if there are any that have had close contact with them, we would take appropriate action. If it's someone who, you know, does not have face-to-face contact with clients, or who doesn't have prolonged contact with clients, typically we don't need to do anything further. If it's someone who has prolonged interaction with individuals, we would take further action. So it really, there isn't a one size fits all for these situations, which is what makes it really challenging. Another question was, is the increased number of cases due to farm workers? And in part, the answer is yes to that. It's not completely yes, but it's partly yes. Are antibody tests available, and how does one get them? They are available. You'd have to get an order from your healthcare provider, and you'd have to go to a lab to get your blood drawn. The accuracy of the tests is not perfect. And with the amount of COVID we have in our community, if you were to get a positive result, it's predictive of a true positive about 30 to 50%. So it has a high false negative rate, because there is a lot of cross reactivity. So you would not want to rely on it for telling you that you are immune. And we don't know if it really does indicate you're fully immune and for how long it would be. So just keep that in mind if you were to pursue testing. This next question I will answer, but then I will probably let Kevin add to it if he would like. I heard that if there are cases that need ventilators, Gerber Hospital sends those patients to Spectrum Grand Rapids. Will those patients not show up in Gerber Spectrum cases, even though they originated in Newaygo County? It makes things look like we don't have serious cases when we do. I'm not as familiar with how the hospitals report diseases. For public health reporting, it's all based on your address of residence. So if you live in Newaygo County, everything is reported as a Newaygo County case. So again, I'll let Kevin finish that one. And then there's a couple further questions that I'll leave for Kevin to answer as well.
Okay.
To clarify, this is Caroline Rain from Spectrum Health. A patient at Gerber on a ventilator may not necessarily go to Grand Rapids with COVID. We did transfer one from here, but we have kept them also in the regions. So I don't want you to assume that if they're on the ventilator, they're automatically going to Grand Rapids.
Okay.
Okay, thank you. And that in our northern counties,
I'm becoming
which are
extremely suspicious of you. You have made it so hard for just your average user to negotiate their way through the multiple sign-up processes. I mean, you could have just done this via Zoom. Bing, bang, boom, easy. No, you make it real hard. I went through 7 pages just to try to get to this meeting. And I am not computer illiterate. I'm relatively computer literate. And, you know, the blocks that you have put out there for people like me make me highly suspicious that you actually don't want the average Newaygo resident to see or hear this. Got it? Am I making myself clear to you? You could have made this a whole lot easier. You could have just gone with Zoom. Now I got to go through 7 pages. And
I'm sorry, I apologize. I muted you sir. I realize that you are having some issues and we apologize for that. We are doing the best we absolutely can to get this information out to the public the best way we know how. This call is being recorded. We will have it posted on our website. We will be accessible for questions and answers as they come in, and we'll be sure to make sure that you get your questions answered as quickly as possible. Again, we apologize. Technology is challenging on our end as well. And I just hope that you all bear with us as we get through this call and try to answer your questions. Again, we apologize for the challenge that some of you are having. Dr. Morse or Kevin, if you want to unmute yourselves again.
I'd like to quickly just say that it was the easiest thing for me to get on, and I'm not very tech savvy, but I got an email, and all I did was phone in, or I could have clicked on the link. So I really appreciated the work that the health department did to make this easy for me.
We appreciate hearing that. Thank you guys so much. Again, we're doing the best we can. We want to get this information out to all of you. And just know that this recording will be on our website. We'll have a link where you can go to find it.
Okay. Dr. Morris, did you want me to answer those other two questions then?
Yeah, so I think in terms of the hospital reporting, I'm not sure if they report things differently, but again, they all are reported under their county. And then the last two questions, the one about pools and about schools.
Yeah. Okay. And just the one piece that I did want to say about the hospitals all operate a little bit differently. I know in our northern counties, and I think I was starting to say this, in our northern counties, which are our Munson hospitals, they did designated certain hospitals that would receive their COVID patients. So not all of the local hospitals are seeing those. And again, that is a individual hospital and an individual system decision as to how they wish to handle that. The other two questions, one of them related to schools, and it is anticipated that the governor's school reopening plan is going to be released tomorrow. We have not seen any of the specifics associated with that plan yet. There has been some discussion or some conversation, nothing official though, that they may follow a process similar to what the courts are using. And what the courts have in place is a set of criteria that is broken into different phases. And so the phases are a 14-day period, and the courts have to go through that process. And then there is data or metrics that have to be met within that time frame. Usually the two sets of metrics that they go by are either a downward trend in the positive number of cases over that 14-day period, or a downward trajectory in positive test results based on all of the test results over a 14-day period. Now, again, I have not seen any of the specifics associated with the school reopening plan, other than the little bit of discussion that the schools may follow a similar process. But like all of the school personnel, we are kind of waiting to see what's going to be included in that plan tomorrow, and then look at moving forward with that. The other question had to do with pools, and under the executive order, outdoor pools are able to be open at 50% capacity. Indoor pools and water parks are only allowed to be open in MERC Region 6, which for our jurisdiction is our 5 northern counties, and MERC Region 8, which is the Upper Peninsula area. Those are the only ones where indoor pools and water parks are able to be operational, or should be operational, I should say. And I believe those were the two questions, unless there were some others, Dr. Morris.
So we do have quite a few questions that have come through the chat line, and also I've been emailed a few questions. I'm just gonna, if Dr. Morse, you're good, I'm gonna go to the questions that have come through, unless you had something else to cover. You good? Okay. Okay, so the first question that I have is from Chief Laud Hartman. The question is there any thought to restricting bar and restaurant traffic or closing them down in light of the high numbers?
Well, I think
Kevin
that
or
kind of-
Lori? Go
go
ahead,
ahead.
Dr. Morse.
No, I was just going to say, I think that might have to come from the state level or from Kevin or Lori.
Yeah, we have not had that discussion or conversation internally yet. Obviously, we could consider issuing a public health order to do that. Obviously, there is some considerations that need to go into taking that action. Part of that would be taking a look at what is it that our contact tracing and case investigation is showing. Is there a large number of cases that are resulting as a result of contacts in those type of establishments? So, Lori, I don't know if you're on or have anything else. Lori is our food service coordinator, food safety coordinator. So from a food standpoint.
No, I'm sorry. I just stepped back and they had somebody outside,
Okay.
so I missed
Okay.
the question entirely.
Okay, that's okay, Lori. I can get with you. I can get with you later. But right now, no, we have not considered taking that action.
Okay, next question. Do you have any recommendations to local government? This question is from Claudia Russell Hoden. So Claudia, if you want to hop on, unmute yourself and go ahead, Dr. Morse.
Well, I was just going to say, I mean, the best thing I can think of is, you know, ensure that all your government offices are following all the recommendations. I know we've heard of, you know, organizations, government agencies not following recommendations, and just encourage all your citizens to be a good example for things like masking and social distancing and, you know, not shaking hands, things like that. You know, continue to follow safe meeting practices. I'll pass it to Kevin if he has anything he'd like to add.
The only thing else I will add to that is at this past Friday's Board of Health meeting, our board did request or ask if we would put together a statement on masking and on prevention, and then share that with them, and then they would push that out from the county level to kind of help be a lead in getting people to wear masks or face coverings, social distance, and that. And so we are in the process of drafting up that message, and then we'll be sharing that with our county government leaders.
Thank you. Thank you.
Janine, you're on mute. Blah, 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 blah. Sorry. Sorry. Teresa Stewart asks, why are citizens not being made aware of where these outbreaks are occurring? During the weekend of June 20th, Grand Traverse had one visitor that had COVID-19. The public was made aware of all the public places they had visited. I think we've covered this, Dr. Morse, if you just want to review that one more time.
And I did contact Grand Traverse because that is not the typical response. Because again, you know, one sick person going into a store is not considered a risk, but they did say it was part of a group that was having prolonged close contact in bars and other locations. So they did feel it was a risk because of that close interaction. Again, if I were a COVID positive person and I went grocery shopping, unless I stopped and had a long face-to-face conversation with someone, it's not considered a high risk situation. It really is, you really do need to get a sufficient amount of respiratory droplets into somebody's face to infect them. So, and this has been discussed quite a bit in the public health circles. So that is why I reached out to Grand Traverse, because I just was curious. So that was a unique situation, and it is not something that they routinely do at this point. So, but again, if we had someone who was having prolonged contact with with groups of people and they weren't able to tell us all their names so that we could contact them individually, we would make a public announcement as well. I hope that makes sense.
I think to add to that, Dr. Morris, it is challenging. I know that people want to know the public places where an individual has been. The point is, however, the guidance does not change whether you know about a location or not. The guidance is exactly the same, and it is to social distance, mask, and wash hands regularly. Because people are out in public, going to public locations in every community, it's very possible that an individual could have been at the gas station right before you, was asymptomatic and not known it, and the gas station not knowing it, or us not knowing it. So it's important that we all try to follow that guideline of masking and sanitizing and washing our hands immediately after getting gas, doing those necessary steps to try to prevent getting it. That's another reason that it just doesn't necessarily, by telling you that somebody went to one gas station as opposed to another, doesn't make you at any less or more of a risk of getting it, because so many people could be out in the community, have it and don't know it, and are inadvertently spreading it. So with that, the next question is, will you announce businesses where outbreaks occur?
And I'll start and then I'll turn it over to Kevin. But again, these have been non-public businesses. So the only people exposed have been the workers. And of course, they are fully aware. And for I guess we don't want to really drag anyone through the mud and make them seem like they're not doing the right thing, because many of these businesses are doing everything they can and working wonderfully with us. And so, because again, telling the public that X company has an outbreak is not going to help the public in any way, shape, or form, but it might hurt that company's business or their image, and their employees may then be looked upon differently by those in the community. So again, we share the information that needs to be shared to protect the community. And in that situation, it wouldn't help anyone just because they don't need to know to protect themselves, since it's not a publicly open business. And again, for the sake of that business, if they would like to put out a press release, we would do that jointly with them. But we don't want to, put negative attention on them. So I'll defer that to Kevin if he would like to add to that.
No, I don't have anything else to add. I think that's pretty much the stance and the position that as an agency we have taken. We will share information to the extent necessary to protect the public's health. But again, as Dr. Morris had reiterated, the outbreaks that we've had to date are not in readily accessible public places.
You're on mute again.
You're on mute, Janine.
Sorry. If the person exhibits no symptoms but tests positive, can they spread the disease?
Yes, they can. There's a couple caveats to that, and I don't want to make it too confusing. You can test positive for quite a long time. So some people will be sick or may even be asymptomatic and no longer be contagious, but still test positive for quite some time. So that can make things a little confusing. But as I mentioned earlier, they estimate about half of all infections have no symptoms at any time, and they can be contagious. They're not as contagious, though, as someone who has symptoms. People that have symptoms are the most contagious, and they're actually the most contagious the 2 days before they have symptoms. So the pre-symptomatic and symptomatic are the most contagious. I know it's very confusing. It gets very frustrating for all of us, but the short answer is yes. The long answer is it's a spectrum. I know, it's very difficult.
Okay. So let me move on to the next question real quick. Some people wonder if so many people have no symptoms or have mild symptoms or are not sick enough to be hospitalized, why is there so much concern? And why should there be so much stress on shutting down the economy, public places, wearing masks, etc.?
That's because of, you think back to when this began. If you have a slow trickle, let's say, and it's about correct, 10 to 20% of illnesses get really severe and have to be hospitalized. Well, if you have a slow trickle, we can handle that. But if we let the floodgates open, 10 to 20% of a floodgate is enough to overwhelm our healthcare system. And, there were times where we had hospitals that literally ran out of ventilators, ran out of medication to sedate people on ventilators. We were running out of supplies. So we expect people to get sick. We know people are going to get sick. We know that the majority of them are either not going to have symptoms at all or just not feel that bad at all. We have some who feel horrible for a long time, who need to be hospitalized and who need ventilators. So we have to basically open up the floodgates really slowly, so it's just a trickle, so we don't overwhelm our healthcare system again. We're not trying to keep this shut down completely. We need to keep from overwhelming our healthcare system again, because I don't want intensivists to have to decide who gets a ventilator and who has to die, because that's literally what it will be. So again, we just need to keep this at a slow trickle, and that means for those of us who are asymptomatic or pre-symptomatic, we have to wear our masks. We have to stay distance from everyone so we're not spreading it. And then, I spread it to someone who spreads it to someone's grandma, and then she has to be in the hospital. So I know this is so frustrating and so difficult, and I know we're all sick of it. I'm sick of it. But that's the whole reason, is we don't want to go back to how it was in the beginning when we literally didn't have beds and ventilators for people, because that's what could happen. I hope that makes sense.
Okay. Next question. How are hospitalizations being reported for Oceana County? If a person is hospitalized in Muskegon or Ludington, will that still be reported for the county or residency of the person?
And I might defer this to Kevin or Robin. I know we don't always know who gets hospitalized or who is in critical condition. So I don't know if either of you have a better answer for that.
Robin, do you, or?
Actually, we do initially report it with our statistics that are for our website when we get the first case report. But that is true. In some cases, we won't be notified if somebody's actually become an inpatient. But most of the local hospitals have staff, especially infection control nurses, who keep in close touch with our public health nurses. So we're usually in the loop, but it is hard to report that specifically.
Mm-hmm. But a positive case is assigned to the county of residence for that individual.
Mm-hmm.
That's correct.
And also hospitalization numbers are being reported on the state website, correct? I know that we don't currently have them on our dashboard with regard to, oh no, that's testing. Testing numbers are reported on the state site. Each hospital system reports their hospitalization numbers on their site, though, correct?
Some may report it as an individual hospital number. Some may report it as a system-wide number. It varies by hospital and by system.
Okay. Okay, so the next question, how are workers who live in congregate housing isolating or quarantining themselves to reduce transmission?
Who do you want to take that one, Kevin?
Robin, do you want to start from your involvement with the investigation and contact tracing? You're on mute.
Robin, you're muted.
Can you hear me now?
Janine.
Yep.
Yes.
Depending on the situation, people who live in family homes are instructed on how to isolate or quarantine specific to how many people are in the home. Other group living situations, we have to look at individually and also tackle that same question of keeping people separated and not sharing the same space. So I would say it's definitely an individual situation each nurse looks into as the positives are reported.
Dr. Morse, do you want to add anything?
No, but clearly that is a very big challenge that plays into these situations.
Okay, we'll move on. Will you provide the names of the farms and facilities that have increased in COVID?
I think we covered that already, that at this point it's not essential to share that.
Again, farms and facilities are typically not open to the public, so so the public has less of an opportunity to become infected at one of those locations, which is why we don't release the names. Okay, next question. Are test results still taking 7 to 9 days, and can we do anything about this? Other counties have less than 24-hour turnaround time. 7 to 9 days for result is certainly not ideal for many reasons.
So I think our routine testing locations take only 24 to 48 hours. I think Robin can correct me if I'm wrong. Some of the pop-up testing sites use different labs that are out of state, and those take quite a bit longer. But our routine everyday testing locations, unless there's big surges in testing demand, do have a 1 to 2, maybe 3-day turnaround. Is that correct, Robin?
Yep, that is correct. Some of the hospitals are doing a rapid test. Sometimes we're notified within 24 hours, but the typical is about 1 to 4 days, except for those outliers like the pop-up testing labs occasionally.
Mm-hmm.
So the District Health Department number 10 has been hosting some pop-up community drive-through testing sites. We've had one in Newaygo County. We just completed one in Manistee County. Our next one starts tomorrow in Wexford County, which is in the Cadillac area. And we have a few others scheduled in other counties in our jurisdiction. And those tests are done by the National Guard. And it's a program that we helped coordinate with Michigan Department of Health and Human Services and the National Guard. So it's really them doing the testing. And the contract is with BioReference Laboratory there, and so that's why these pop-up tests are taking a little longer to get results back, because they are being sent to one specific lab that does have that 7 to 9 day turnaround. And we, unfortunately, for the pop-up test, that's the way it is. So,
but even
next question, real quick.
But with those I was going to say, with those pop-up tests, though, the positive results that we have found from those, we have been notified within 48 hours of positive results. So.
Right.
Hi, I just wanted to make a comment on the one you had in White Cloud. This is Diane Taylor Chandler. Yes. It was excellent. And Ken DeLotte on Near North Now wrote an excellent article about the whole process. So if somebody was concerned about how it all works and what it feels like. Of course, Ken's hilarious, so you get past all his humor introduction, and then it really details the whole thing. And I thought it for someone that was worried about the process, if you could read that, it would help you not have quite so much fear or whatever about actually getting tested. Thank you.
Thank you for the comment. We appreciate hearing that.
No problem.
Excuse me, can I raise my hand?
Sure, go ahead.
I just, joined in of late. I just want to get in the lineup for posing a question.
Okay, we are reading the questions that have been written in the chat first, and then I'm going to open it up for others to ask questions. So we're just about
Okay.
finished with those, and then I'll make sure you get your question asked. Okay?
Okay, cool. I'm standing by.
All righty, thank you. So the next question, real quick, what is the website for the toolkit? And we have a website on a page on our website. It's www.dhd10.org/coronavirus. DHD, that's D as in district, H as in health, D as in department, 10.org/coronavirus. And we will, the toolkits are there. This video will be posted there, and there's our dashboard is there that you can see a lot of data about testing or not testing, but case and probables in each of our communities. So we encourage you to go there. Next question, the community, especially farm worker community, could greatly benefit from live training by health department staff on the prevention and spread of COVID-19.
I would have been, yes.
Based on the number of citizens positive with COVID-19 in the county, will DHD10 or other health organizations doing any live training? Will you be doing live training?
Can't remember if I'm, oh no, I'm not muted. I know MSU Extensions actually is doing a training in July. And that's where it's a little bit of a struggle for us because we're not farmers. And so we know a lot about disease prevention, but it's sometimes hard for us to translate that into farming practices. But we have talked quite a lot with Migrant Affairs and MSU Extensions and MDARD. But I do know, and I have passed it on, this has kind of been passed through different health departments, but MSU Extensions is doing a training. It's not live. That's kind of the problem with COVID right now is all in-person things are discouraged. But I know MSU Extensions is doing a training.
Okay.
And I can get that, I'll get that to you, Janine, so you can put it on the website if I didn't share it with you yet.
Sure. Okay, what have the two businesses that have had major outbreaks done to mitigate additional cases and protect the remaining employees and community?
I would pass that to Robin since she's most aware.
Actually, the larger outbreaks, the human resources representatives at each location are working very closely with our public health nurse, Claire Jansen, and the toolkit has been shared, and a lot of their practices are immediately like from that toolkit and from the CDC with screening for temperature and symptoms at the beginning of the shift, making sure that employees are wearing masks and the distancing. And whenever we have a positive case that's identified, the HR representatives also work very closely with Claire to identify any potential exposure in other employees. So she is on the phone daily with HR.
Okay. Next question, is there any data available yet on antibody testing? Lakeshore, Mercy, and Spectrum launched antibody testing 2 weeks ago.
I'm guessing that question is in terms of how many are positive, and I couldn't answer that. I know there is data on the state website as to how many antibody tests are being done in each county and in the state. But in terms of the percent positivity, that is not being reported as an aggregate right now.
And certainly if the question is more geared toward where do you get antibody testing, I mean, it does say data available on antibody testing. So I think you're right, Dr. Moore.
Mhm.
for getting tested. The hospital systems, I think, so Munson, Mercy, and Spectrum, I believe, are offering antibody testing.
And the CDC is doing large community and national testing as well. And they're doing it mainly on blood collections that are being done on individuals, not specifically for antibody testing. So, if someone were to go in to get their cholesterol tested, they'd sign a waiver to have it also tested for antibodies. So, and I think their first report is due to come out soon. So there is research coming out. In terms of Michigan, though, there's not been anything published yet or put out yet.
Okay. Next question, can the County Board of Commissioners make mask wearing mandatory in Oceana County?
Well,
Kevin, you want to take that? Or Dr. Morris?
Well, I was going to say, according to the executive order, I believe mask wearing is already mandatory in any confined area and by those working, if I'm not mistaken.
Correct. The issue, the problem is the enforcement is the ability to enforce that order, because there's really not an enforcement mechanism on there. And, that enforcement would go through law enforcement, which has, their resources are stretched thin as it is. So that does present a problem.
Okay. Next question, based on what you're saying about prolonged conversations, are you supporting not wearing masks while in public unless you are having 15-minute plus long conversations with others?
No, because there's always that what if you coughed or sneezed? What if you coughed or sneezed on an item and someone touched it, then touched their face? So again, we see that the majority of cases are in people that work or live together. There's that small percentage that they don't know where they got it. So we're trying to prevent they don't know where they got it. And so again, those are people that might have touched their nose and then touched a doorknob, that might have coughed or sneezed into the air. And so there's larger droplets. So the vast majority of cases are going to be those that have either prolonged contact, frequent contact, or have those longer conversations closer together. So the masking of all I know it's so difficult. Of all the things we can do, if you took out masking, we might see a 20% increase. So it's just one piece of the puzzle. So I wouldn't want to take out one piece. It may not add that many extra cases, but it obviously does make a difference. So they do recommend, though, that if you're more than 6 feet apart, you don't have to wear your mask. So if you're in an office setting and you're in a meeting and you can all sit 6 feet apart, you don't have to wear your mask. If you're outside, you don't have to wear your mask if you're 6 feet apart. So again, there are times where you do not need to wear a mask.
Okay, just trying to find, we're getting some good feedback that it was an extremely easy process to get on this call. So we thank you guys for that feedback. Maybe it might have been difficult for some, so I don't want to say that everybody had an easy time, but let's see, what can be done about the indoor water park operating in Oceana County?
If this is the indoor water park at the Double J Ranch, that we were in communication with them over the weekend, and that indoor facility should be closed at this point.
Okay. Just want to move to the next question. Are all of the workers in the factories and farms that are sources for the outbreak being tested?
I can
Yeah.
talk to that. Yes. A great majority are at this point. There has been testing offered in one particular instance, but also from what we're seeing from the results coming through, large numbers of employees are now going through testing, and we share the hotline numbers for the local testing facilities with the human resources directors at the facilities as well. But we are seeing a lot of results coming through.
Next question. What if the people not wearing masks have asthma?
Then they don't need to wear masks. There is an alternative. Face shields, plastic face shields that come down below the chin and around the sides of the face are an alternative to wearing masks. And, you know, for some, they can't wear masks because of claustrophobia. And the face shield may not be an alternative, but, you know, if you have employees or family members or others who can't tolerate the mask, I have asthma and I really don't like wearing a mask, but I do it. But I completely understand that is an alternative. I think an added benefit is you can't touch your face. So if you have someone who maybe has a hard time with touching their face, that might be an alternative. But again, that's I kind of mentioned that earlier, but I may have spoken pretty quickly that there certainly are people that can't tolerate the mask, whether it's claustrophobia, anxiety, COPD, CHF, asthma. And so we don't want to necessarily scowl at everyone who doesn't wear a mask because they might have a legitimate reason. However, when you see, you know, the entire store, none of the employees are wearing a mask, it gets a little bit more challenging to think that they all have a legitimate reason to not wear one. We have heard of stores putting up signs saying, you know, we have employees that may not be masked due to medical reasons because maybe they were getting some negative feedback, but I do feel for the people who have health reasons and can't wear a mask because whatever little protection they might get to themselves from wearing a mask, they can't benefit from. So that makes it a little more scary for them too. So.
Right. And I think it's important to note too, for those who have asthma or who have some underlying other medical conditions, it'd be worthwhile to avoid large public settings. Avoid, you know, if you can have others go to the store for you, if you can avoid, you know, going to facilities where large people are congregating, or, you know, that just might be something that you have to do for now if masking isn't something that you're able to do. So, okay, next question. Do you think that campgrounds or beaches would have a public announcement? Are public announcements made online? I guess I'm not sure what you mean by would they have a public announcement? Andrea Stratton, if you're still on, or Kaylee, ask those questions.
Hi, this is Andrea Stratton. By public announcement, I meant like if there was a breakout at, let's say, one of the campgrounds in the county, would there be a public announcement for something like that, or like the beaches? Because those are, you know, state things that, you know, I realize bars and restaurants, that sort of thing are unique. It'd be hard to figure out if it was at a gas station, but I feel like at such a beach right now when it's 90 degrees and so many people are gathering, and at the campgrounds, they just opened last week, Monday, you know, just how does that, would there be an announcement made for campers or for people that are going to the beach?
Yeah, and that's kind of the dreaded situation, isn't it?
Yeah, I mean, I think a lot of that would be dependent upon what we identify and what we find from our case investigation and from the contact tracing in terms of, you know, how, you know, what do we learn? How much information do we feel we have? If obviously if we feel, you know, not real comfortable with all the information that we're getting, then possibly, you know, we would take that step to do it. But I think a lot of that would be dependent upon what we find from our investigation.
And then also just a follow-up to that as well, with like this, would the next logical step be, and maybe you don't know this, but would the next logical step be then to possibly close down campgrounds again if there were a big, I mean, if there's something, is there a plan in place, I guess, if something were to happen with our state parks where there is an outbreak and a known outbreak, would they potentially shut down again?
Again, I think potentially, again, depending upon the event and the extent to that event, in terms of how many individuals, you know, may be involved with that, then I cannot rule that out.
You know, I think a similar scenario happened in Lansing with a bar that they had an outbreak associated with those that were at the bar, and it was announced. So I would think that if it were something that was known, right, Kevin, and we could associate an outbreak with being at that vicinity, it would be reported to the public.
Yep. And again, a lot of that's the information that comes from our investigation.
Right. Okay. Kent County offers information by zip code. Will that ever be an option? And I do see that somebody answered that further down. We do have zip codes on our dashboard. If you haven't found it yet, the dashboard is on our dhd10.org/coronavirus page. The first thing you see is our dashboard. It takes a little bit for it to load because there's a lot of data in it, and there's multiple pages on the dashboard. So you have to go to, I think it's the second page of our dashboard has zip codes, cases by zip code. So both probable and confirmed cases by zip code, you can see those there on our dashboard. What are affected businesses doing to mitigate further exposure? I think we kind of touched on that one already. Again, it's up to every individual business to really do their part to implement social distancing among their coworkers, to implement screening processes, and to try to track those employees that may have said that, or, you know, if obviously if they have a temperature or have symptoms, there's a process in place for what to do in that case. So it's just important that all businesses follow that type of guidance to prevent further spread. I'm asthmatic and have no problem wearing a mask, as somebody had said. So that's a comment. You may have already answered this, so I apologize if you did. Are you working with businesses to make sure they are following proper COVID-19 policies and procedures? How are you supporting them and making sure they're following proper protocol to prevent future outbreaks?
We did release our reopening guidance document that we had sent out via our Gov delivery system. Included as part of that, we had identified one of our staff people, Karen Ripke, as our reopening liaison. And so this is the individual that has been in contact with those businesses or work sites and is able to answer questions that they may have. If she can't, then she brings those questions back to our team and we provide an answer and then get that information back to them. So that's been conversation that has been ongoing with those establishments.
And just to add to that, Kevin, we've had a fair amount of businesses that have called and they do have very good plans in place. Everything that I've suggested to them, they've already been thinking about and they're looking at guidance. So we do have a lot of businesses in our community that are really working hard to make sure that they're following procedures and keeping their employees and their customers safe.
Yep. And I believe all of that reopening guidance is on our website, correct, Janine?
Mm-hmm. That is correct. It's on our website, and we also we send out a daily update to our partners in our community, and every community that we cover. Approximately 975 individuals that we consider our community partners or emergency contacts, such as schools and nursing homes, long-term care facilities, and law enforcement, and emergency managers, county administrators, directors of public safety in every single county that we are in, that we service. We send out a daily update to them that gives not only the case counts, but we give them all of our updates as far as business guidance, any updates from the state, any updates from the CDC, updates from the White House. We send that communication to them on a daily basis. In fact, yesterday was our 100th day of sending that daily update out to our community partners, with the goal that they will push that information out to others, to other organizations, to the public, and share this information with others. So we do have that established, where we're trying to push out as much communication to community partners as we can, and then they can subsequently share with their partners and others. So next question real quick. I'm curious about what the main symptoms are that we're seeing for COVID-19 for the positive cases.
The most common symptoms are fever and dry cough. Fever is not present though in up to 20% of cases. So I know a lot of people rely on that, and that's not always present. Other common symptoms are sore throat or scratchy throat, runny nose, headache, body aches, new onset of loss of smell or taste. About 10% of people will get diarrhea, stomach upset. So, and again, some have no symptoms. Some have very, very mild symptoms, just a mildly runny nose, and they think it's allergies. Some feel fine for about the first week to 10 days and then get severely ill and have to be hospitalized. We've had some report that they feel horrible for months. So it's really kind of all over the place. But again, the top two most common symptoms are fever and dry cough.
Okay. What does the county predict for the rest of this week or this month? Who's got that crystal ball that they can look into to make a prediction?
I don't know if Robin wants to take a stab at that, if she has any sense of, it seems to be pretty steady right now. I don't know if.
Yeah, it is very steady. I have hope that we're going to level off or decrease, but honestly, I don't think we can predict. But there are a lot of people getting tested. There's actually one location right now that's requiring any new employee to get a test before they start. So I think that we have a lot of awareness around here, and hopefully eventually we will get everybody tested and have a better handle on what happened.
I think the challenge to think about when it comes to testing, though, is that it's only a point in time. It's just a snapshot of where you are when you get tested. So you could be exposed the very next day after you get tested. Your results could come back positive or negative, and you could be positive because you were exposed the day after you got tested. So it really is just a point in time and a snapshot of where you are when you got tested. So. Okay, next question. If cases are attributed to the county of residence, do you have any reason to believe Oceana County's case count is inflated by persons who are not currently in or near the county, such as Florida snowbirds? Are our cases inflated by people who aren't typically residing in the county? Sandra Kirsten?
So like I said, I did find that there were some people that we counted as Oceania cases because they were here visiting from another state. If someone winters in Florida but is up in Oceania for the summer, they would be counted as an Oceania case. I didn't see a lot of that. but I went through all of our cases over the weekend. The majority, the vast majority, other than, like I said, about half a dozen that had traveled in from out of state, were, from all that I could tell, year-round residents. What it doesn't capture, though, because I know this is happening in another county further north, it's not part of our district, but they're seeing a lot of positives in people that are traveling up from downstate. So, their county might look like it has a pretty low incidence, but they're actually seeing a lot of positive test results in their facilities in summertime travelers, basically. So that's always a risk when you live in a nice, beautiful county where people like to recreate, is there's always a chance that there are actually more infected people coming in you just don't know about, because if they go to urgent care over the weekend and get tested positive, it might go back to Wayne County or Detroit City. So you don't know that those positive people were in your county, if that makes sense.
Positive cases are counted where you reside and where you're recuperating, right? So if they are,
right.
if they came up here, they were tested up here, and they are recuperating up here, even though this isn't maybe their permanent address, but if they were tested and are recuperating here, they would be counted here. If they got tested here and then went back home and are recuperating back downstate or at their permanent residence, they would be tested at their permanent, or be counted in their permanent residence, correct? The county where they reside.
Right. Is that right, Robin? I mean, if they're staying here for months, we would probably count them as here. It kind of depends on what health department manages the case. So.
Yeah, that's correct. And actually, whenever there's a question, we will consult with one of our regional epidemiologists to determine where we're counting that case so that it can be counted accurately and we're not inflating the numbers.
Mm-hmm.
Okay. Okay, next question. How far into the future do you think people will have to continue to use preventative measures in regard to COVID-19 transmission? Again, get that crystal ball out.
I don't know, Kevin, you want me to break the news?
Well,
So,
sure.
Well, according to experts, the expectation is probably, until we have a good vaccine and about 60 to 70% of the world is immune to COVID, it's going to be around. And so that might be another 12 to 16 to 24 months. Now, how much of the measures that we're using now are we going to continue to have to use will hopefully decrease with time as more and more of us get immune. So again, like I mentioned, just gradually opening that floodgate so that we just let things trickle through. So as more people get infected and get immune, the better. But until we get 60 to 70% of people immune, either through natural infection or vaccination, this is going to continue. So hopefully we'll get a safe, effective vaccine soon so that it's closer towards the 12 months rather than the 24 months. But again, hopefully with time, we'll be able to gradually lessen the precautions that we're using. But that's why we really need to keep working at it now, because if we just drop everything, it's going to go back to stage one and we'll have to go back to shutting everything down again. And that's, none of us want that.
Right. Okay, statement from Gwen at Northern Michigan Health Services, Inc. In Shelby, the testing site, they recently experienced a longer wait time with their lab there due to the increase in volume they were processing. So it can take up to a week to get your results back if you were tested through Northern Michigan Health Services, Inc. Let's see here. Experienced the COVID test in Manistee last week and agree it was quick and relatively painless. I really appreciate the workers out there doing this testing. So thank you to Helen Johnson for that. Next question, are there any additional supports that affected farm workers need? How can the area organizations help?
don't know,
Well,
Robert or Kevin.
I know that Claire has been sharing resources from the Migrant Council with the businesses. And we also have community health workers who have been making sure, actually, let me go back a little bit. When we have a positive case and the nurses are interviewing and our interpreters are interviewing the families, we are assessing for any unmet needs. And we have community health workers who are meeting those needs, whether it be food or other resources. So we really are trying to connect in all the community resources that we can to support them.
Oh. And I see Dale Freeman has popped on, and I know Dale's been involved with some of the work that we've done. Dale, do you have anything you'd like to share?
Well, I just wanted to say that the migrant program that's located in Oceania, MDHHS, is working with other agencies, including the Health Department, as well as the Interagency Migrant Resource Council. The West Michigan Migrant Resource Council is a format for service agencies in your area to identify needs and direct services to them. So if you're wanting to contact them, you can contact through me. My email address is freemand@michigan.gov, and I'll put it on there. But also, if you're more familiar with the people in the local office, the Oceania MDHHS office would be your contact.
Great. Thank you, Dale. There is a question about hotline numbers and other COVID-related materials. Are they available in Spanish or other languages for the migrant farm workers? Also, are people at the test site bilingual, or are there translation services provided? Does somebody want to answer that, Robin, or?
This is Dale again. There are resources available in Spanish as well as in indigenous languages, as well as, of course, in English. We have access to them at MDHHS, and I believe that you folks at the Health Department also have access to them. We are trying to work together to make sure that people are aware of how to respond to the coronavirus, to prevent it, and about testing. So we're working actively with the Oceania Health Department on this.
Yes, and we have been sharing that information. Claire has it right at her fingertips too, to keep sharing it with anyone who needs it. I personally have looked up the Spectrum testing hotline and took a picture of the Spanish information to share with one of our nurses who is doing contact tracing. So we definitely are trying to get the right materials out there. And
of course, Northwest Michigan Human Services is providing health outreach for migrants in your area.
There was a follow-up. Mercedes Berrigan asked about testing utilization. Are we utilizing translation services for testing and providing information in other languages other than English? Are the clinicians administering the tests or checking people, are they bilingual? So I know that at our testing sites, we always, at least our pop-up testing sites, we try to have a translator on hand, and we do have Spanish materials, and definitely will provide other materials in other languages as requested. Amelia has a suggestion that to anyone looking for frequent updates, you can sign up for Newaygo County Emergency Services. They sent out a direct link via this meeting email, so feel free to do that. That's a helpful resource to get updates and alerts. Okay, since it sounds as if DHD 10 is not actively looking to issue a health order to enforce or mandate wearing masks, have any communities considered a mask wearing ordinance to push the guidance on mask wearing to a more enforceable position? If you have or have considered it, please let me know. Thanks.
Again, to issue an order would require that become enforceable. And so, the local health departments, with the exception of a handful do not have the authority to issue any type of fines or citations as a result of that. So again, it ends up going back to partnering with our local law enforcement to be able to do that. So you know, it can be a bit of a challenge for a local community to do that.
Okay, we have a couple of hands raised. Sharon Halleck is a guest on the call. Sharon, you have your hand raised. You can unmute yourself and ask your question.
Sorry, I put it in the chat and it's already been addressed. Thank you.
Okay. Okay, thanks, Sharon. How about Deb? Deb has her hand raised. Deb is a guest on the call.
Thank you. You guys have done an outstanding job. But my question is, we have a building in a rural area, our conservation club, and we usually open it for the use of AA meetings. And we are planning a rummage sale in that building next month. And I wondered if anybody had comments on anything that we need to do. I mean, we'll be masked if we're there for like the rummage sale and social distancing, etc. But I believe that AA has recommendations for their meetings. But is there anything that we bear responsibility if we reopen the building to their meetings?
You know, there's probably a little more in the way of specifics that we would need to know. I'm wondering if you would be willing to either email myself or Karen with some of that information, or at least provide a contact so that we can get back with you and we can see what we can do to get your questions answered.
Sure, thank you.
Okay.
Okay, I just have a couple of questions that came in via email. One says, I have been told that people that are known to have been exposed to COVID-19 that work in nursing homes were allowed to go to work because they're considered essential, even though they work with very sensitive people. Is that true?
Yeah. Critical infrastructure workers and healthcare workers, when it is kind of damaging to their workplace for them to not be at work, are allowed to still work when they are kind of in that quarantine period. So if you are exposed, and this goes for any critical infrastructure worker, so if you're in food delivery or any of those workers who are allowed to work while we were all during the stay-at-home order and staying at home, and the rationale there is that if you take all the proper precautions to keep safe, it's less damaging than you not being able to work and not having a healthcare provider to take care of somebody. If your workplace can cover you, it's better for you to stay home during quarantine though. And there are very specific guidelines on how to keep people at work safe if you are still working while you're during that 14-day quarantine period. So, but we really do try to get people to stay home during those 14 days and try to find coverage for them. But yeah, it is allowable if you are required at your workplace.
Okay, this individual also asked about zip codes. It says, I noticed that on the dashboard that most cases in Newaygo County are in the southern part of the county, and also there's I don't want to name the specific locations, but she's asking if it's possible to loosen up restrictions within certain zip codes, just by zip code. So if we're seeing more cases in southern zip codes in the county, can we loosen restrictions just in the northern zip codes in a county?
Well, and again, those are the zip codes where they live. They may not work there. And so, or it may not be where they shop or recreate or things like that. So, I'll let Kevin answer this as well, but I think that would be very complicated because we have people like for Newaygo County, for instance, they work in Kent County or Muskegon County, and that's likely where they contracted it, but they live in Newaygo. So it gets very, very complicated to really pinpoint what zip code really is where the hotspot is. They might be living in one zip code and that's where the hotspot gets labeled, but maybe people in that community commute and work in another area. So it gets really, really tricky.
Yeah, and the reopening plan for the state is really guided by the governor, and so within the regions that they have created, for good or bad, that is how the reopening process is being rolled out via those regions.
Okay. Another question real quick from email. Is there a particular industry or industries where the cases are higher? I think we've kind of touched on that with farms and manufacturing, where they may have a large number of people working. They may have all the screening in place, but an asymptomatic person that comes to work exposes large numbers of coworkers, and then all of the coworkers and subsequently go home and expose family members. So that's really the main reason I think that the numbers are jumping fairly quickly. Okay, Deb, it looks like you have another question. You raised your hand. Deb, you want to unmute and ask?
No, it said my hand was lowered.
Okay, sorry about that, Deb. Another quick question. Are restaurant staff required to wear masks? We see very little of it in Newaygo. Lori, do you want to answer that?
Sure.
Oop, you're muted, Lori, you're muted.
Okay. Yes, they are required to wear masks, especially if they're at a checkout counter or they're out delivering food in the dining area. But in the back area, they should be wearing masks. If they're not, if they can't maintain that 6 feet of social distancing, they should be wearing masks and gloves if they're handling ready-to-eat foods.
And if you are finding restaurants where you encounter restaurants where you see that within our jurisdiction, let us know that information, and we will make contact with those facilities.
Okay, and then Robert Whittigan is asking, since it sounds, let's see, not sure how to send this. I think we already asked your question, Robert, and answered it. So I think we're good. And if not, I'm going to open it up real quick. So those of you on the call who have questions that have not been answered, please unmute yourself, and hopefully, one at a time. We'd like to try to limit the questions to one per person until we can get all of them answered. But you can unmute yourself and go ahead and ask your question.
I had a question. I've read that the possibility that probably about somewhere in the range of about 10 times the number of cases are probably out there than are already tested or reported. So should we assume that, like, if Newaygo has 150 cases, it would probably be somewhere in the neighborhood of really 1,000 cases out there, just people who've had it, not gotten tested, or are asymptomatic or are sick but just aren't going for a test?
That's a good rule of thumb, and it is hard to estimate. I know when they've done some antibody studies in other large cities, they've found between 4 and 10 times the infection rate. And again, I know Kevin did mention the recovered rate. So, when we say the numbers, that's the total that have been infected, not the total that are currently infected. But that's why it does get challenging to mention where cases have been, because that's just one person that we know has been to that location that's been infected, when in reality, there's probably been 10 others that have been there during that same time frame that have been infected. So it is, the best rule of thumb is just assume every single person, including yourself, is infected at any time in when you go out. And that's why we all should wear masks, because we never know if we're shedding virus. But it'll take us a really long time to look back at some of these antibody studies and things to know how many of us are really infected or were really infected. But it's so difficult and so confusing. So, but that is pretty accurate, at least 4 to 10 times. Yeah.
Thank you.
Yeah.
Anybody else? Any questions? You can unmute yourself if you have a question. Feel free and ask away. Are you telling me we answered all your questions?
There was a question someone asked, would there be another town hall meeting?
Right, I did see that. We don't have another one scheduled yet for Oceana and Newaygo. We definitely will continue to follow what's happening in these communities, and if another one is warranted, we will schedule another one. There is not one scheduled at this time, but again, it's possible that if something changes or we see something new that needs to be reported, we would most likely schedule another public meeting. Somebody's asked, has there been any conclusive evidence regarding blood types and increased risk?
You know, I've seen some studies on that. I haven't read them. I think that'll be another one where the jury will be out on that till there's more data. So, so I can't answer that definitively.
Okay. Any other questions? Steve, Steve, you have your hand raised.
Yes. What about air conditioning, circulating the virus in indoor settings, or ceiling fans?
Actually, the recommendation is to increase your ventilation and to try to increase the air exchange with the outdoor air to try to ventilate it more, rather than circulating the virus. It kind of dilutes it with the outdoor air. So whether or not you've had a confirmed case, but especially if there's been a confirmed case, as much as you can ventilate with outdoor air, that does help to disperse the virus. So that is one of the environmental control recommendations.
So no air conditioning that's self-circulating. Is that right?
If you had, a super small pore filter, perhaps that would help. But if you can change it to circulating outdoor air with your air conditioner, that can help. Certainly, you don't need to stop using your air conditioner, though. And there are spots on the CDC which do discuss that, but there's no recommendation to stop using your air conditioner by any means. The more you keep circulating it, the more it's going to dilute it out and keep it from settling. And so you certainly don't need to stop using your air conditioner. The recommendation just is if you can circulate in outdoor air through your air conditioning, that may help just because you're getting fresh air in through the system.
Thank you.
Yeah.
Anybody else? Any questions we haven't covered? As a reminder, this is being recorded, so we will have it posted on our website. We'll try to get that up there tomorrow. We encourage you to share the link out with others who may not have been able to be on this call. So be looking for that. We'd also like to, in conclusion, talk about what we as District Health Department number 10 are doing in our communities to further educate communities about the importance of masking, of prevention. And we'd like to include Sarah Olenichek. She's our Deputy Health Officer and Director of our Health
education health promotion staff. So we'd like to ask Sarah to just give you a little bit of insight on what we're doing to educate communities. Sarah, make sure you're off mute.
Thanks for the reminder, Janine. I know Dr. Morris talked a lot about case and contact education. Just to follow up on that, District 10 has developed culturally competent video education that's shared with individuals that are placed in isolation or quarantine. And those videos are available in both English and Spanish. We've also created actual prevention videos that talk about COVID and how to prevent it. And that was designed purposely for our migrant farm community. And again, those were developed both in English and Spanish. Those videos are now posted on our website and are located in the video gallery. And if you need an actual copy of the videos, you can email us at info@dht10.org and we can send you that link directly if you need to. Our community health workers are distributing both community education on COVID and distributing masks at various locations in the community. And then recognizing the number of residents expressing a great concern over a lack of community support for face coverings or mask wearing, lack of practicing physical distancing, and concerns of businesses not protecting their employees and customers. District 10 will be launching a project to develop a community education plan for Oceana County specifically. We'll be working to secure input directly from the community members themselves to determine the behaviors, attitudes, and beliefs around COVID-19 prevention at the community level. And then that information, once collected, will be shared for development of a community education plan that really will bring the community to the table with public health to design a plan that will help impact the social norms, the community norms in regards to impacting our infection rates. So we will be recruiting input both through social media, through existing community partner meetings, and again on the street. So if you are interested in providing input or suggestions on ideas on where we can be securing that input, please email us at info@dht10.org for more information. And that's about all I have to share.
Thank you, Sarah. Looks like Diane Taylor Chandler has a question. Diane, you have your hand raised.
I do, and this is kind of controversial. It's really interesting to be out in the public and listening to people saying, oh no, you don't need to wear a mask. No, that's all just, whatever. Do you have any idea where those people are getting that information and how we stop that? It's just, and these are, they appear to be smart people. I mean, I actually listened to a nurse saying that. Well, there was a posting this morning, but I don't know what you would do about it, but it just blows my mind that, oh, it's a conspiracy or whatever. I personally find it really frustrating, and I'm sure I'm sure you do too. So I'm just curious if you have any idea where that thought or that where they're getting that information that they would be so they think that's correct. Sorry.
Hey, Diane, this is Sarah. That's actually our intent, is to try and reach out to the community and find out those answers as to where people are, what they're basing that on, to provide correct information on the guidance and hopefully develop a plan to educate our community. So if you would like to be included in that, please drop us an email.
Actually, I would. I'm on the, well, I'm volunteer for Abby and helped at the testing. But yeah, I would. Who should I send that to?
You can email info@dhd10.org.
Okay, great. Thank you.
We did have a question earlier. Somebody joined late and wanted to know if we had already discussed contact tracing in the district. We did discuss contact tracing quite a bit. This is from S. Green. And this call is being recorded. We're going to have it posted on our website. It should be up there by tomorrow, so you can review what was talked about regarding contact tracing. If you have a specific question, feel free to jump on and ask, and we'll try to answer before we sign off. Okay, any other questions out there? Well, we really appreciate you all calling into this call. We'd like to continue on with these types of town halls as it's warranted. We want you to know that we are here for you, and we are here to answer all of your questions and provide you information that you need. We encourage you to email info@dhd10.org with any of your questions, anything that didn't get covered today, or things you think about in the near future. Feel free to give us an email, and we'll get back to you as soon as we can. Hopefully you found this to be informative and useful, and we encourage you to share the link to this recording with others. So with that said, we thank you all for taking the time out to be on the call with us. Have a great rest of the week and a great weekend and a great 4th of July coming up.
Bye, everyone.
Bye.
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 Bye. Thank you all.
Thank you.
Great job.